How do muscular dystrophy symptoms differ by subtype? Muscular dystrophy is a group of over 30 genetic disorders that cause muscle weakness in different ways. Each subtype has its own pattern of symptoms, progression, and affected muscles. Knowing these differences helps doctors diagnose and manage the condition better. Duchenne muscular dystrophy is the most common form in boys and usually shows up before age 5. Early signs include toe walking, trouble standing up, and frequent falls. Kids often have a waddling gait, delayed walking, and difficulty running or jumping. Their calf muscles may look enlarged, but their overall muscle strength is weak. Most children with Duchenne lose the ability to walk by age 12 and may need help with breathing later. It also affects other organs like the heart and lungs, leading to complications such as heart muscle weakness and spine curvature. Some children may also have learning or behavioral challenges. In contrast, Becker muscular dystrophy is milder and progresses more slowly. Symptoms often appear in adolescence or even adulthood. People with Becker may experience weakness in the upper legs and arms, but they tend to stay mobile longer. The disease still impacts the heart and other organs, but the overall muscle decline is less rapid. Myotonic muscular dystrophy affects adults and can start between ages 10 and 30. Its hallmark is myotonia, which means muscles have trouble relaxing after use. Weakness usually begins in the face, neck, and limbs. People might develop a hatchet face with facial muscle wasting, and some have a distinctive fish mouth appearance. Myotonic dystrophy also affects many systems beyond muscles, including the heart, eyes, and digestive organs. Common issues include cataracts, gastrointestinal problems, and sleep disturbances. Facioscapulohumeral muscular dystrophy often begins in late teens or 20s. It causes weakness in the face, shoulders, upper arms, and sometimes the legs. The weakness usually starts on one side and spreads unevenly. People may notice difficulty smiling, closing their eyes tightly, or raising their arms. Foot drop and walking issues can occur due to weakness in ankle muscles. And like some other types, FSHD is rarely life-threatening but can impact quality of life over time. Some individuals also experience hearing loss or muscle pain. Congenital muscular dystrophy appears at birth or within the first 2 years. It has several subtypes, including collagenopathy, myastheniopathy, and dystroglycanopathy. Collagenopathy tends to be mild with no brain involvement. Myastheniopathy often shows brain white matter changes but usually no serious brain problems. Dystroglycanopathy is more severe, often with brain malformations and eye issues. The symptoms depend on the subtype but generally include muscle weakness and low muscle tone from an early age. Limb-girdle muscular dystrophy is a broad group with many different genetic causes. Symptoms can include joint stiffness, muscle cramps, calf muscle enlargement, and weakness in the hips and shoulders. Some types also affect the muscles controlling the hands and feet, leading to difficulty with fine movements. Emery Dreifuss muscular dystrophy typically starts around age 10. It causes stiff joints, especially in the elbows and heels, and gradual weakening of shoulder, arm, and calf muscles. A key concern is heart problems that can cause fainting or irregular rhythms, requiring close medical monitoring. Distal muscular dystrophy is rarer and usually begins in adulthood. It mainly affects the muscles farthest from the center of the body, like those in the hands and feet. Weakness in these areas leads to difficulty with tasks like gripping or walking on uneven surfaces. Collagen type 6 related disorders include Ullrich congenital muscular dystrophy and Bethlem myopathy. Ullrich is more severe, with early muscle weakness and joint looseness, while Bethlem tends to appear later with milder symptoms. Both cause floppy muscles and joint contractures, but their progression varies. The rate and severity of symptoms can differ greatly across subtypes. Some progress slowly with mild weakness, while others cause rapid decline and significant disability. The pattern of which muscles are affected, how early symptoms appear, and the systemic issues involved all vary depending on the specific type. Understanding these differences is essential for accurate diagnosis and personalized care. It helps healthcare providers anticipate complications and tailor treatments to each person's unique situation. Always consult a medical professional for a proper diagnosis and management plan, as individual experiences can vary widely.